Hi, I'm Andrea Frolic. I'm the Director of the Office of Clinical and Organizational Ethics at Hamilton Health Sciences, and I'm an assistant professor in the Department of Family Medicine at McMaster University. And I've had the distinct pleasure and honor of being a 2015 Phoenix Fellow. I was awarded the Phoenix Fellowship for a project that I call Compassion 360. The premise of Compassion 360 is the idea that we cannot give to others what we don't have for ourselves. And in the healthcare context, where we're confronted by suffering and pain and crisis and trauma on a daily basis, this requires us as healthcare providers to offer compassion to our patients and families. We know the quality of care is better, and we know that patients heal faster when they receive compassionate care from their healthcare providers. So the idea behind Compassion 360 is about developing the resilience of healthcare providers by using evidence-based practices. And the specific practices that we're using are mindfulness-based practices and compassion-based practices. So mindfulness is basically the practice of focusing one's attention on the present moment with a specific intention in mind. In our daily life, our attention is constantly fractured. We have cell phones, we have the electronic medical record, we have the sights and sounds and interruptions of a busy life in healthcare. That often means our attention isn't on the person in front of us, but it's on our task list, on our to-dos, and on the many other ways in which we're pulled away from the present moment. So mindfulness-based interventions actually build the muscle of the brain, if you will, to help busy clinicians to hone their focus, to be in the present moment. Because it's actually only by being in the present moment that we can really attune to that patient's story and to that patient's need. And it's in the present moment that we can really express a compassionate connection with them. Our research also shows that not only does it help people to be more focused and thereby avoid inefficiencies and avoid mistakes in their clinical practice, it also allows them to really connect with the patient's story and connect with their own compassionate heart. So in Compassion 360, we've developed a number of evidence-based interventions to develop this muscle of the brain that helps us focus in the present moment and connect with compassion. Some of these interventions are formal classes that we offer in the hospital to our frontline staff and our leaders and physicians. Some of these interventions include developing a community of practice of mindfulness practitioners to help support the integration of mindfulness at the front line with patients and families and with our colleagues. And we're also developing a community of practice across Canada for mindfulness teachers, practitioners, and researchers who are experimenting with using some of the neuroscience evidence behind mindfulness to really develop a more resilient, a more compassionate, and a more effective and efficient workforce using mindfulness and compassion interventions.